The subclavian artery anatomy. Welcome to this in-depth exploration of the anatomy of the subclavian artery, a topic of immense importance in both clinical and surgical practice. Today, we will take you through its origins, course, branches, and key relationships, while also highlighting clinically relevant conditions associated with this remarkable vessel. Overview of the subclavian artery. The subclavian artery is a major paired blood vessel, essential for supplying blood to the upper limb, head, neck, and thoracic wall. Its name, which means under the clavicle, aptly describes a significant aspect of its course. There are two subclavian arteries, the right and the left. Although their origins differ, their pathways and branches are largely similar once they move beyond their initial segments. Origin and segments. Let us begin with the origins. The right subclavian artery arises from the brachiocephalic trunk, located behind the right sternoclavicular joint. In contrast, the left subclavian artery originates directly from the arch of the aorta, within the superior mediastinum. Each subclavian artery is traditionally divided into three parts by the scalenus anterior muscle, which passes in front of the vessel. The first part extends from the artery's origin to the medial border of the scalenus anterior muscle. The second part lies posterior to this muscle and is the shortest segment. The third part stretches from the lateral border of the scalenus anterior to the outer border of the first rib, where the vessel transitions into the axillary artery. Course of the subclavian artery. From its origin, the subclavian artery arches laterally and superiorly. It passes behind the sternoclavicular joint and travels across the upper surface of the first rib, posterior to the middle of the clavicle, following what is known as the subclavian groove. Upon reaching the outer border of the first rib, it enters the cervicoaxillary canal and is then referred to as the axillary artery. Branches of the subclavian artery. The subclavian artery gives rise to several important branches along its course. Although variations do occur, a classic description includes 5 main branches. From the first part, we find the vertebral artery, which ascends through the foramina in the cervical vertebrae to enter the skull, where it contributes to forming the basilar artery and supplies the brain and spinal cord. The internal thoracic artery, also known as the internal mammary artery, descends into the thorax behind the costal cartilages to supply the anterior chest wall, breast, pericardium, and the anterior intercostal spaces. The thyrocervical trunk is a short branch that quickly divides into the inferior thyroid artery, which supplies the thyroid gland, lower larynx, esophagus, and trachea. The suprascapular artery, which provides blood to the supraspinatus and infraspinatus fossae, and the transverse cervical artery, often giving rise to the deep cervical branch, supplying the posterior neck muscles. The second part of the subclavian artery gives rise to the costocervical trunk, which runs posteriorly and divides into the deep cervical artery, supplying the deep muscles of the posterior neck, and the supreme intercostal artery, which supplies the first and second posterior intercostal spaces. The third part commonly gives off the dorsal scapular artery, though its point of origin may vary. This vessel descends to supply the levator scapulae, the rhomboid muscles, and contributes to the scapular arterial anastomosis. It is important to note that the dorsal scapular artery may arise directly from the third part of the subclavian artery or, more commonly, as a branch of the transverse cervical artery. The right subclavian artery may give off a right internal thoracic branch, while the left side may demonstrate an origin variant involving the left common carotid artery. Key anatomical relationships. Understanding the anatomical relationships of the subclavian artery is crucial for both surgeons and clinicians. Focusing on the left subclavian artery, let us review the most significant structures in proximity. Anteriorly, from medial to lateral, are the common carotid artery, the internal jugular vein, the vertebral vein, the vagus nerve and its cardiac branches, the ansa subclavia, which is a loop of the sympathetic chain, and the scalenus anterior muscle, which separates the first and second parts. The phrenic nerve courses along the anterior surface of the scalenus anterior. The subclavian vein runs anterior and inferior to the artery, separated from it by the scalenus anterior muscle. Also anterior are the clavicle and the supraclavicular lymph nodes. Posteriorly, the artery lies in relation to the apical pleura of the lung, also known as the cupula, and the suprapleural membrane, the sympathetic trunk, the stellate ganglion, and, for the third part, the first rib. Superior to the subclavian artery are the roots and trunks of the brachial plexus, which are positioned posterosuperiorly, especially in relation to the third part of the artery. Inferiorly, The first rib and the pleura are found in relation to the first and second parts, while the subclavian vein runs anteriorly but at a lower level. Clinical and surgical relevance. Let us briefly discuss some important clinical correlations. Subclavian steal syndrome occurs when there is stenosis or occlusion of the first part of the subclavian artery before the origin of the vertebral artery. This leads to reversed blood flow down the vertebral artery to supply the arm, potentially causing vertebrobasilar insufficiency, which manifests as dizziness or fainting during arm use. Thoracic outlet syndrome refers to the compression of neurovascular structures, the artery, vein, or the brachial plexus, within the cervicoaxillary canal, which is the space between the first rib and the clavicle. Central venous access, such as catheter placement in the subclavian vein, requires a thorough knowledge of the anatomy, as the vein runs anterior to the scalenus anterior muscle and is separated from the artery. This understanding is essential to avoid accidental arterial puncture or injury to the pleura, which can cause a pneumothorax. Blood pressure measurement in the arm relies on the ability to compress the artery against the first rib. In summary, the subclavian artery's complex anatomy and its relationships with critical neurovascular and musculoskeletal structures render it a vital consideration in cardiothoracic, vascular, and neurological medicine. Thank you for joining us on this comprehensive episode. If you found this deep dive into the subclavian artery valuable, please like, share, and subscribe. It's the Everything Surgery Podcast. Dissect the extraordinary.